And now, as we finally get together face to face, there's a lot to look back on these past 2 years and much to look forward to. Joining us now here in studio is current IASP President Claudia Sommer. Thank you so much for your time today.
Thank you for being with me.
It has been a wild 2 years, that's for sure. What was it like trying to navigate a pandemic while also fulfill your duties of this role and provide the assistance that your members need?
Everything has been very different. You know, my first Congress with IASP in my role as president was a virtual Congress. I had a virtual inauguration speech.
Oh.
And the many plans I had, what I wanted to do during this term of presidency, it all boiled down into video conferences and virtual meetings with everybody. But we did as best as we could. And on the other side, it was also very different for our members. Mm-hmm. Many of our members are practicing clinicians, anesthesiologists who were called back to their intensive care units to look after the very ill patients there. So their commitment for the pain clinics had to be cut back. Mm-hmm. So everybody's life had changed, and we just had to navigate it from day to day.
So what would you say has been the most rewarding part?
Several things. I mean, the good thing was to see things getting done even during the pandemic. Mm-hmm. With IASP and with the team. We did a lot of things even under the lockdown conditions. We got the new website up and running. We inaugurated the new task force of the young people, of the early career people. And we also worked on our new strategic plan. Sometimes it's good to have some time to sit back. Mm-hmm. When you can't be so active traveling through the world, mm-hmm. but sitting back, thinking about the vision and the mission of IASP, and to think what is really important to us.
Wonderful. Let's go back to the members. And what did you hear from members that were some of the biggest challenges that they faced?
For our basic scientists, their labs were shut down for months and months during the lockdown. The postdocs and students, they were not allowed to go there. And there's quite a bit you can do in home office. You can think about your projects, you can write your papers, but the experiments, they were stuck. Mm-hmm. And of course also the clinical research with patients and volunteers who come into the clinics to get tests and to be part of clinical trials. This was all stopped and like this very much delayed.
You know, the theme of bridging the gap is a big one here this year. Where would you say the biggest disconnect is between the researchers and clinicians and doctors and those with the actual lived experience of pain?
There are many small disconnects. And this is why I'm so happy that the Global Year Task Force of this year is trying to bridge this gap with looking at what pain research can do for the clinic and what we can bring into the clinic. There are the usual disconnects between what we learn from the animal experiments and what we bring into humans. For example, there's a wonderful drug that reduces the pain in the mouse, but the human person just doesn't have the same receptor as the mouse. So these examples, or the other one that we know from clinical trials, that we should do this or that treatment, and we put it into the guidelines, but the busy clinician doesn't even have time to read the guideline and still does it the way they did it 10 years ago. Little things like this, or also what we as clinicians think is a good outcome for a patient or a good improvement, those people living with pain, they may tell us, no, this is not what we want, this is not helpful. And we have to talk more, we have to talk about all these things to have this communication going. And I think our Global Year 2022 only started this, and it will be ongoing, and I'm very glad about this.
All right, another focus here this year is the focus on young professionals and really helping them advance their career. What would you say is a key aspect of meeting the needs of those up-and-coming young professionals, and how does IASP do that?
So my approach when initiating this task force of the young people was that it would come from them, that it wouldn't be the old people telling them what they need. We do this anyway. We give them stipends, we promote their research, so we're thinking of ways to meet them. We give them a way to connect, to meet. But I want to hear it from them, and this is what they're working on right now, to define their own needs and how things could be done better. What we really want at IASP is to have young people in all our committees, in all our task forces, to have their representatives, because, I mean, they are the future.
Right. Yes. Wonderful. Well, thank you so much for your time today, and congratulations on the conference.
Thank you. Thank you so much.